Hey there, thank you once again for joining me for a little bit more about home-based balance rehab, a review of the literature. So in this video, I'm going to talk a little bit about how after you take this course, your practice is going to change for the better. So one major way that I think this course is going to help you do that is by getting you a little bit more comfortable with performing an oculomotor exam. So these are all things that we've heard about before, like VOR, saccades, smooth pursuit, among others. But it's not something that we consistently as clinicians will include in our evaluations, unless that's something that we hone in on specifically all the time. If we're a vestibular specialist or a balance specialist or a vision specialist, something like that. But if you do these assessments consistently, you can more specifically identify where your patient's impairments are, and therefore can more specifically provide the interventions that they need. So what we do during this course is we go through a whole slew of different oculomotor tests and teach you how to start slow and incorporate one or two into your evaluation. There are certain ones that you can very easily clump together to make the process more streamlined. And then you have a lot more comprehensive information to go off when you're planning your interventions and formulating your plan of care. Another major way that your practice is going to change is that you're going to really understand, how effective some of these interventions we talk about during the course are and how fun and easy they really are to incorporate into your intervention list for these patients. So yoga, video games, walking programs, and cognitive therapy, so dual tasking situations. These are all things that can be used in most settings. Video games is probably the most restrictive, but there are plenty of rehabs, plenty of skilled nursing facilities that have these types of systems that can be utilized. So it does really depend on what resources are available to you, but you are really going to come away with a better understanding of how easy these things are to incorporate and also how effective they are at really helping your patients' balance to get better and putting them at less risk for falling and injuring themselves. So I really hope you check it out. You can go to arcseminars.net and you can see if there are any live offerings, and then also at any time you can take the webinar. So I hope you do, and I hope you enjoy. Thanks.